system and their hormonal system.
Yeah, well, I think that gives us a bit of context to start exploring. When someone arrives at, say, some sort of diagnosis such as non-specific low back pain, which is typically a lot of people will present without maybe the mechanical symptoms, sciatica, clear nerve compression or something like that. Typically, it's often very difficult for people to ascertain, okay, well, what structure is causing the pain? And if you do image these people, sometimes it comes back with almost, very normal findings. It suggests that there isn't actually anything going on from a, pathology point of view.
You see that a lot too, not just with the spine. I know certainly with the hip, there's a lot of research showing that age groups associated with developing OA who present with symptoms of OA who actually on imaging don't have any indications of degenerative changes at the joint. And conversely, again, seeing people that have a lot of osteoarthritic or indications of osteoarthritis on MRI yet being asymptomatic. So you see quite often this decoupling between what the image finds and what the person actually presents with.
What do we do about this? Because it seems like it's a deep hole to go down. As soon as you start looking at this, you start to consider, well, okay, if this is what's presenting, but I'm not seeing these changes, say, on imaging, how do you actually address the problem? What are the things that potentially you need to start looking at? What are the areas that you need to start exploring? Because it can be very frustrating as a clinician. It can be very frustrating for the patient because the patient wants a clear diagnosis often.
Yeah, absolutely.
They want to know, okay, well, what's damaged and what's causing the pain.
And look, you and I have talked about this recently of some of the dangers you also run into with not giving a clear diagnosis. And it's a bit of a double-edged sword in that sense because patients typically like a diagnosis because they like to be able to identify with a particular pathology or condition, but depending on their perceptions of that condition, they may have a lot of negative connotations associated with that.
Yeah, if you say, okay, I think it's discogenic in nature or whatever, then all of a sudden they start to have these strong ties because the context with back pain is that at a cultural and societal level, we see disc injuries as being severe, as being typically long-term and potentially something that will have, future effects.
Yeah. But yeah, going back to your question of what do we do with this? Well, context is important here because like you mentioned before, if someone came in, say, following direct trauma to their spine and you suspect, say, a fracture, then yes, okay, that's going to require specific management and that will often, more than not, require, say, investigations to confirm or refute that diagnosis and then may require medical or surgical intervention.
Do you think that, do you think that often enough clinicians will diverge their thinking at that junction? One of the first questions I think that's really important to ask, obviously you want to know where the symptoms are presenting. The second one seems to be, okay, did this occur in one known incident, right? Or is it something that has come on over time?